Have you ever wondered why that home pregnancy test you carried gave you a false positive result? Most women might have experienced this, while some women might have never had such experience. Most at-home pregnancy strip make use of a dipstick that is usually placed in the urine of a woman, and this dipstick detects a hormone called human chorionic gonadotropin hormone, that is HCG, a hormone that is usually found in the urine or blood sample of a pregnant woman. So why the false positive result? The first reason why you might have a false positive pregnancy result is accuracy. Once you walk into a pharmaceutical store to purchase a pregnancy strip, the first thing you should look at is the expiration date on that pregnancy strip, because an expired pregnancy strip will always give a false result, whether negative or positive result. And also, once you get home, do not be in a hurry to carry out that pregnancy test. Always go through the manufacturer's instructions, that is the instruction that specified how you should carry out that test. The manufacturer of a pregnancy strip might instruct that you should read the result at 3 minutes. And in a situation where you do not go through the manufacturer's instruction and you decide to read that result at 1 minute or 5 minutes or even 10 minutes, you might get a false result. The next reason why you might have a false positive pregnancy result is recent miscarriage, recent abortion, or recent childbirth. During pregnancy, HCG is that hormone that is being detected in the urine or blood sample of a woman that is pregnant, and this HCG increases throughout pregnancy and regresses back to its normal pre-pregnancy state after childbirth. Whether that pregnancy was terminated, that is aborted, or miscarried, or it was carried to term, that is eventually gave birth to that child, it takes about 60 days, though individually, for HCG hormone to regress back to its normal pre-pregnancy, that is its normal level before pregnancy. If you eventually carry out a pregnancy test whilst HCG hormone is still present in your blood sample, you might end up with a false positive result. Certain fertility medications do contain HCG hormone, and whenever a woman who is on this medication carries out a pregnancy test, the woman might end up with a false positive result. Also, some antipsychotic medications, that is medications given to people with psychological issues, can potentially trigger the release of HCG, and whenever you carry out a pregnancy test when you are on this drug, you might end up with a false positive result. Medical conditions like ovarian cyst, kidney disease, and certain cancers can also stimulate the release of HCG, and whenever a woman with any of these conditions carries out a pregnancy test, she might end up with a false positive result. The next reason why you might have a false positive result is menopause or premenopausal period. Normally, during menopause, there is hormonal imbalance, and this can also stimulate the release of HCG, and whenever a pregnancy test is carried out, this might give a false positive result. So if you are unsatisfied with the pregnancy test you carried out, it is very important that you get yourself a new kit and repeat that test to avoid a false result. And also, if you had a positive result but you have several concerns, especially when you notice unusual symptoms, it is also very important that you consult a healthcare professionals, because those symptoms that you notice might be a sign of other medical conditions that, if left untreated or unattended to, can complicate your health.